Welcome to my YouTube channel Logic and Art. Today's topic is anterior triangle of the neck. So the objectives are: what is the location, boundaries, subdivision, contents and clinical significance of anterior triangle. The anterior triangle of the neck, it's actually situated in the neck. It's in the side of the neck. So the shape of the neck, what do you think it is? It is in three-dimensionally it will be cylindrical, but from side profile it appears like a quadrangle. So you have to know the neck from side profile is a quadrangular structure. So quadrangle will have these many boundaries, 4 boundaries it will be there. That's why it's called quadrangle. This is the anterior boundary, this will be the posterior boundary, superior boundary and inferior boundary. So the quadrangular structure is divided by one muscle. That muscle name is sternocleidomastoid. It starts from sternum, cleido means clavicle, and goes towards the mastoid process of temporal bone. It is on the side of your neck. You just turn your chin to one side or face to one side. This neck becomes prominent on the opposite side. It's called sternocleidomastoid. This obliquely oriented muscle divides the neck into two triangles. A triangle which is behind this is called posterior triangle, this one. And the triangle in front of the sternocleidomastoid is called as anterior triangle on this one. So the side of the neck is divided into two triangles, anterior and posterior triangle, by a muscle called as sternocleidomastoid. Coming to the orientation of these two triangles, you can see the boundaries of the neck. Every time if you write one diagram, it's better to write the orientation of it: superior, inferior, anterior, posterior. However obvious it may be, you should write those things. Orientation of the triangle, coming to the posterior triangle, the apex is pointing upwards and the base is directed downwards, and it is behind the sternocleidomastoid or posterior to the sternocleidomastoid. Whereas anterior triangle is exactly opposite of this. The base is towards the mandible and the apex is towards the sternum. So it's inverted triangle. The anterior triangle is a inverted triangle and it is situated in front of sternocleidomastoid. Coming to the various boundaries of this triangle, anterior triangle. The superior boundary. So once you know that there are 4 boundaries: superior, inferior, anterior, posterior, it is important to know which boundary you are talking of. Superior boundary is formed by the base of the mandible and an imaginary line from the angle of the mandible to the mastoid process. Anterior boundary is from the chin or the symphysis mentae till the suprasternal notch of the sternum. The posterior boundary is the anterior border of sternocleidomastoid. So these are the 3 boundaries of the anterior triangle. So coming to the further subdivision of the anterior triangle, the subdivision of anterior triangle is done by some muscles. You can see 3 muscle bellies here in this anterior triangle area. So what are these muscles? We have to remember that to understand the subsequent subdivisions. So this is called omohyoid muscle. It is actually coming from the suprascapular notch of scapula, simply called as a shoulder. Omo means shoulder, going towards hyoid bone, omohyoid. And this belly is called the superior belly, whereas the inferior belly is there in the posterior triangle. This muscle is present next to the chin and mastoid process. It has got 2 bellies. If you open up your thumb and index finger and observe, so it will have 2 bellies. Anterior belly next to the chin over here. This is a posterior belly next to the mastoid process. So there are 2 bellies, anterior belly and posterior belly of a muscle. It's called digastric. Because it has got 2 bellies, therefore it's called digastric. So these 3 muscles subdivide each anterior triangle into 3.5 triangles. So we'll see what is this 3.5 triangles. A muscular triangle. This triangle below the hyoid bone. This is the hyoid bone. Okay, and this triangle is called as muscular triangle because there will be only muscles in this triangle, and all these muscles will be below the hyoid. So what do you call these muscles? Below the hyoid, infrahyoid muscles. Okay. The next triangle will be this one, between this sternocleidomastoid, posterior belly of digastric and omohyoid. In this triangle you can see great blood vessels of the head and neck, that is carotid arterial system, common carotid, external, internal. Therefore this triangle is called as carotid triangle. This triangle is very straightforward. Superiorly mandible, on either side inferiorly it will be by the 2 bellies of digastric. So majority of this triangle is bounded by digastric. Why don't we call it as digastric triangle? Some authors also tell that this triangle is below the mandible, so they also mention this as submandibular triangle. The half of the triangle is visible here, the last one, half of it's beneath the chin. So chin means mentum, so beneath the chin, submental triangle. So these are the 3.5 triangles which are the subdivisions of the anterior triangle of the neck. Hope you understood this. So coming to the roof, this is in toto the roof of the entire anterior triangle: skin, superficial fascia containing cutaneous nerves, and a muscle called as platysma. Investing layer of deep cervical fascia is also next to the superficial fascia. All these are present in the roof of the anterior triangle. Coming to the floor, this floor is the entire anterior triangle. I am telling it again: mylohyoid muscle, thyrohyoid, cricothyroid, hyoglossus from hyoid to the tongue. And then there will be 3 muscles covering this tube called as pharynx. From above downwards, like one cup being placed into the another, there will be 3 muscles: superior, middle and inferior constrictors of pharynx. All these form the floor of the anterior triangle of neck. Coming to the contents of the anterior triangle. The contents of the anterior triangle can be divided into muscles, vessels, nerves and other structures. Muscles are mainly the infrahyoid group of muscles which are there in muscular triangle. They are sternothyroid from sternum to thyroid cartilage, sternohyoid from sternum to hyoid bone, thyrohyoid from thyroid cartilage to hyoid bone, omohyoid, that is the superior belly of omohyoid, which is present going towards the hyoid bone coming from the shoulder. These muscles, all of them are below the hyoid bone, so we can group them as infrahyoid muscles. Coming to the arteries, mainly the common carotid, internal carotid and the external carotid artery. So the common carotid has got 2 modifications at this level, especially in the carotid triangle. It will get dilated to form one sinus called as carotid sinus. This carotid sinus acts as a baroreceptor. Any pressure changes which happens over here will be sensed immediately by the brain and the blood pressure is regulated, and that is called as baroreceptor reflex. And there will be one body, it's a ganglionic body, it is next to the carotid sinus. So this body is called as carotid body. It is made up of neurons, and this carotid body acts as a chemoreceptor. Any chemical changes which happens over here will be directly controlled by the brain and it's regulated reflexly. So it's called as chemoreceptor reflex. It's mediated by carotid body. So carotid sinus is baroreceptor and carotid body is chemoreceptor, carotid sinus is baroreceptor. These should be present over here because the important organ brain is situated just above the neck, that is within the skull. So any change in the blood supply or the ions in the blood can alter the nerve impulse within the brain. So therefore they are present over here. Next, this common carotid splits up into 2 arteries. One goes inside the skull to supply the brain, that is internal carotid artery. It doesn't give any branches in the neck because it has to give inside the skull. The other branch is called as external carotid artery. This is external carotid, gives majority of the branches on the outside of the head and neck. This superior thyroid, lingual, facial, ascending pharyngeal, occipital, all these branches are present in the anterior triangle. Come to the veins. The partner of the internal carotid artery and common carotid artery is internal jugular vein. So this is a partner for carotid arterial system. It drains the brain basically. And the next, common facial vein, which will end up in internal jugular vein. This actually partly drains the face and partly drains the scalp. Common facial vein. Pharyngeal vein, as the name suggests, drains the pharynx. Lingual vein drains the tongue. And there will be many other veins which is not mentioned here, that is thyroid veins, laryngeal veins, pharyngeal veins, esophageal veins. All these will end up in IJV, internal jugular vein, major vein of the neck. Nerves. Come to the nerves. It appears like a never ending list, but it's very simple. The last 4 cranial nerves are present in the anterior triangle of the neck. So what are they? The glossopharyngeal nerve, 9th cranial nerve, glossopharyngeal nerve, is a nerve of tongue and pharynx. Vagus nerve, it's a nerve of G8, 10th cranial nerve. And the branches from vagus which are supplying the larynx and pharynx will be there here. The superior laryngeal nerve, it splits up into external and internal laryngeal nerve, which controls the larynx or the voice box. The spinal accessory nerve, which controls the sternocleidomastoid and trapezius muscle, will also be present in this triangle. The hypoglossal nerve, which supplies the muscles of the tongue, that is the 12th cranial nerve. This spinal accessory is 11th cranial nerve. So this is 9, 10, 11, 12. Very easy. Glossopharyngeal, vagus, spinal accessory, hypoglossal. Hypoglossal nerve controls the muscles of the tongue. Then also cervical part of the symphytic chain, which is 3 ganglion, superior, middle and inferior cervical ganglion, is also situated just behind the carotid sheath in the anterior triangle itself. Come to the other contents, the connective tissue. The connective tissue which is encircling the common carotid and internal carotid artery and the IJV, internal jugular vein, and the vagus nerve is called as carotid sheath. The lymph nodes which are along this internal jugular vein will be termed as deep cervical group of lymph nodes, deep in the neck, which means to say like that, deep in the neck, deep cervical group of lymph nodes. Come to the clinical importance, last slide. Congenital cysts are more common in the head and neck, especially in the anterior triangle. If it is present in the midline, it is called as thyroglossal cyst. If this thyroglossal cyst conformation, if you protrude the tongue, the cyst moves upwards. That means it is derived from thyroglossal duct. The other cysts are branchial cyst, which is present along the anterior border of the sternocleidomastoid. They are the remnant of the endodermal pouch or the pharyngeal pouch. The carotid pulse is felt in this triangle just in front of the anterior edge of the sternocleidomastoid, pressing against the carotid tubercle, that is a tubercle present on the anterior surface of C6 vertebra. Then carotid artery aneurysm, the bruit can be heard over the, if you auscultate over the anterior border of sternocleidomastoid, you can hear one bruit, that is one noise over the artery. That means the artery, there is a turbulent flow of the blood in the aneurysm. Then injury to these nerves, 9th, 10th and 11th cranial nerve will have their own symptoms. 9th cranial nerve, the glossopharyngeal. So what symptom you can have? Difficulty in swallowing you will have. 10th cranial nerve, vagus nerve supplies GIT. So you will have indigestion you can. 11th cranial nerve supplies two muscles, which are the sternocleidomastoid and trapezius. So the person will not be able to move his neck to the right or left, depending on which side the lesion is, and also he will not be able to shrug the shoulder because spinal axis nerve supplies these two muscles, sternocleidomastoid and trapezius. 12th cranial nerve, hypoglossal nerve, it's a motor nerve of the tongue. So the person will have dysarthria or difficulty in speech. Next, thyroid swelling, it's a midline swelling. It is present in the lower and anterior aspect of the neck, just above the suprasternal notch. Thyroid swellings move upon deglutition, that is because of the modification of pretracheal fascia, which is anchored to the hyoid bone and oblique line of thyroid cartilage. Also one thickening is there, which is called as ligament of Berry. So during deglutition, epiglottis slightly falls backward, but the entire larynx moves upwards, and this butterfly shaped gland is also attached to larynx. So when the larynx is moving up, this will also move. That is thyroid swellings. It will move upon deglutition. Last but not the least, lymph node swellings are also common in the head and neck. There are nearly some 700 to 900 lymph nodes in the total human body, out of which nearly 300 lymph nodes, 300 to 350 lymph nodes are present in the head and neck region. Any infection in the oral cavity, nasal cavity, any orifices in the head and neck or the skin, the deep cervical group of lymph nodes will be enlarged. They will be bead shaped. There are so many tumors of the lymph node also, like lymphoma, which is a Hodgkin's lymphoma, non-Hodgkin's lymphoma, where the person's neck will become like a bull's neck. It's called bull neck deformity. So that is about lymph node. Always we can do FNAC for lymph node whenever the lymph node is involved, especially the left supraclavicular lymph node if it is involved. It is called Troisius sign, and the node is called as Virchow's node because thoracic duct ends here. The thoracic duct drains the entire abdominal cavity. Any organ, especially the liver, stomach, or the intestinal tumors, they can end up in the neck lymph nodes. That you have to keep in note, and that is called as Virchow's node, the left supraclavicular lymph node. Always it is better to do FNAC to rule out any tumor, metastatic tumor or the primary tumor like a lymphoma. It can be Hodgkin's or non-Hodgkin's lymphoma. Details of this will be done in pathology. Thank you for watching this video or learning. Kindly subscribe and press the bell button. Like, comment and share if you like this video. Thank you once again.